Hi, I'm Dr. Kim with Pro AcuHealth, integrative medicine and acupuncture for pain management and your well-being. Today's topic is sciatic pain, also known as sciatica and sciatic nerve pain. I'll first talk about the Western perspective, and then the Eastern perspective, and then the treatment options for both. Most importantly, I'll go over how I treated my own sciatic pain. Let's start with what is sciatic nerve pain. Sciatic nerve pain is defined as pain radiating along the pathway of the nerve due to pressure, compression, or even tight muscles. In order to fully understand sciatic nerve pain, I think it's really important to understand the pathway of the nerve. The sciatic nerve originates in the lumbosacral plexus, L4 to S3, located in the lower back. It then passes through the gluteal region and then travels down the back or sides of your thighs and legs until it reaches your feet. This major structure of the lower limb is thick and flat and will eventually split to form the tibial nerve and the common fibular nerve. Now that we know the details of the sciatic nerve, it's easier to imagine why some people experience pain on one side and others experience both sides. Also, some people will report pain traveling down the back of their legs and thighs, while others may report on the side. So again, everyone's body is different, and basically it just depends on where the sciatic nerve is being affected. Pain or feelings of discomfort can come from anything compressing or pushing on the nerve. So bulging disc, herniated disc, even bone spurs. Anything pushing on the nerve will cause discomfort or pain. Besides anything compressing or causing pressure on the sciatic nerve, you can also experience sciatic pain through tight muscles. So there is this tiny little pyramid triangle shaped muscle deep in your gluteal region. It's called the piriformis muscle. So anatomically, most individuals, their sciatic nerve will pass under this muscle. For some individuals, the sciatic nerve will actually pass through the piriformis muscle. So when that muscle is tight, or maybe you've been sitting in a wrong position for too long, it will actually compress the nerve as it passes through the muscle, causing sciatic pain. It's also really important to mention that not all individuals feel pain. Some people with sciatic problems have tingling, numbness, they also have muscle weakness or difficulty walking. Treatment will vary according to the reason for the sciatic pain as well as the severity of pain. So a patient with mild pain will probably get an ice pack and some physical therapy recommendations, whereas someone with intense, severe pain might get all of those things in addition to some tests and also maybe an injection. Let's go over some of the common treatments for sciatic pain. Heating and cooling packs. Cooling packs are great for decreasing inflammation. Medications, we have over-the-counter as well as prescription. So we have anti-inflammatories, NSAIDs, muscle relaxants, and neuropathic medications. In severe cases, we also have an epidural steroid injection. Physical therapy and exercise is always helpful with sciatic nerve pain. Besides all of these, we also have other therapies available. There's acupuncture, cupping, chiropractic services, physical therapy, yoga, really about finding what works for you. So now let's talk about Eastern medicine. The most common diagnosis for sciatic pain in Eastern medicine is stagnation. What is stagnation? Stagnation means something's not moving. In this case, it's blood and qi. And I'll definitely go into it in more detail in the future. But for right now, just know that qi is that energy source that keeps that blood moving. Besides the fact that something's stuck or stagnant, we also have to look at why something is stagnant. In the case of sciatic pain, it's most likely due to cold or dampness. If cold is causing the blockage, then we have to heat things up. If there's dampness, we have to get rid of the dampness. We have to tonify or strengthen the middle jiao, the spleen and the stomach. And then we also have to get things moving. When coming to a diagnosis, we can even look at the seasons or the weather. For example, an individual who is more susceptible to cold and dampness may experience more pain or sciatic symptoms during the months where it's more cold or rainy or damp. Besides the feelings of pain and discomfort, some patients will experience B and Way syndrome, which is an overall aches and pains or muscle weakness. Some Eastern medicine practitioners will look at where you're feeling pain in order to take a closer look at what's happening inside your body. For example, if you have pain in a certain spot, that might signify to them that you should look at your kidney or your lung or your liver. That tiny little spot corresponds to somewhere in your body. Before I start talking about herbs and formulas for sciatic pain, I think it's really important to mention that you should talk to your primary care provider or herbal specialist before starting any type of herbal medications. Every body is different, and so it's really important that you get the proper diagnosis before you start anything. There are several formulas which are useful and common in treating sciatic pain. Most of these formulas not only get things moving, but they also tonify and nourish the blood. We also have formulas that tonify the kidney, which plays a huge role in lower back pain. These formulas include Shu Jing Ho Shu Tang, Du Ho Ji Zhang Tang. Formulas tend to have a variety of herbs, each playing their own role in the formula. Du Ho is a very common herb used for its function to strengthen the kidney and relieve back pain. Du Song is another herb that's very popular in treating pain of sciatic patients. It's known to decrease inflammation as well as take care of back pain. Dang Gui is another popular herb, not only for decreasing pain, but for increasing circulation. So as you can see, these three herbs play major roles in herbal formulas for sciatic pain. I recently experienced sciatic pain after sitting on a plane cross-legged for way too long. The pain started out sharp and quickly progressed to so painful I could barely walk. I am going to share with you exactly what I did in order to alleviate my own pain. Acupressure, cupping, a massager, a cooling pad, and a heating pad. When doing self-acupressure, I choose one of these. Self-acupressure is easy to do. What I do, I slowly palpate the area, finding areas of pain or tenderness. Once you find the right spot, you can simply push on that spot or even gently massage it. You can use your finger or you can use a stick or even a chopstick, anything to apply pressure. You can do that for 5 to 10 minutes. These painful or tender points are called Ashi Points. So they're not the usual acupuncture points, but they're points on the body where there's pain or discomfort. The points that you choose for acupressure can either be Ashi Points, which are those tender points that we pushed on earlier, or they can be traditional points on the meridians. Traditional points for sciatic pain include the extra point HZ Huangzhang. We also have UB23, UB25, GB30, GB34, and GB40. Extra point HZ Huangzhang is located in the gluteal region. GB30 is also located on the gluteal region. UB23 and UB25 are located on the lower back. GB34 is an important point for muscles and tendons, located on the front of the lower leg. UB40 is located in the back of the leg at the midway point of the popliteal crease. So how did I treat my own sciatic pain? I first started with cupping. So I went ahead and palpated the area and I found areas of sensitivity or pain. I would then cup those areas, moving gently to stretch. And then after about 2 to 5 minutes with the cups on, I went ahead and did acupressure. After the cupping and the acupressure, I then used my massager, placed it on a chair, sat back, and I finished up with a heating and a cooling pad. Alrighty, you guys, that was my video on sciatic pain. So I hope that I was able to help you. I hope that some of your pain was alleviated. And if you guys can, please like, share, and subscribe. And if you have any suggestions on what you want to see in the future, please leave me a comment. Thank you so much. Lots of love. See you next time.